Good day, everyone. On behalf of the principal author, Ms. Jopal Diaz, former staff nurse at San Lazaro Hospital, Manila, Philippines, now working as a staff nurse at Regency Hospital, South Carolina, USA, and co-author Dr. Maria Cecilia O. Martinez, Pampamantasan Lungsod ng Maynila, I, Dr. Jennifer P. Reyes, co-author 2, also from the Pamantasan ng Lungsod ng Maynila, is grateful and honored to present the paper entitled Usability and Perceived Effectiveness of Coping Strategies of Significant Others, Caregiver of Patients, both infected and affected with HIV/AIDS. Keywords: usability of coping strategies, effectiveness of coping strategies, usability and effectiveness of coping strategies of caregivers of patients, both infected and affected with HIV and AIDS. For the introduction, coping, according to Folkman 2013, is the person's cognitive and behavioral reactions to control their internal and external stressors. The same author said that how do they perceive stress depends upon their ability to cope. In the Philippines, it is common that coping from stress is derived from the strength of the family as they provide care and support to each other during times of stress. Family members like siblings help and support their sick family members even if it is dreaded disease like HIV/AIDS. According to Mariana et al. 2020, family support lessen the sense of loneliness and has an absolute role in alleviating depressive symptoms. Their family and friends are the ones helping them, carrying greater burdens for longer period of time. The study of Bandeventer and Wright 2020 revealed that the caregiver of HIV/AIDS patient carry heavy burdens on how to meet care costs such as food, transport, and medical costs, and they had to deal with their own health and physical problems. This situation usually happens nowadays due to recent medical advances, shorter hospital stay, increasing lifespan with better management of chronic illnesses, limited discharge planning, a shortage of home care workers, and the expansion of home care technology that have increased the caregiving responsibilities of families and friends. The researchers believe that being a Filipino with a culture of close family ties, these caregivers of family friends usually do not think of themselves. According to Family Caregiver Alliance 2006, a large and growing body of evidence reveals that providing care for chronically sick person can have harmful physical, mental, and emotional consequences for the caregiver if the patient is infected or affected by human immunodeficiency virus and acquired immune deficiency syndromes, because it is not easy to care for a person with this disease. The situation mentioned poses a very disrupting question, such as how these people cope while they struggle to care for family and friends, putting their own health in danger, or at least as they usually feel unprepared, have inadequate information regarding the disease and the care required. As a result, according to Given and Sherwood 2006, they neglect their own health and portray inadequate coping reactions. This motivated the researchers to pursue this study to be able to determine how do significant other caregivers use coping strategies and how effective are they when they use it. For the methods, this study utilized the descriptive type of research, specifically the descriptive correlational design, to determine the usability of coping strategies and its perceived effectiveness by the significant other caregiver of patients, both infected and affected with HIV and AIDS. Data were gathered using the revised version of Jollywood coping scale by Dr. Ann Jollywood for the measurement of the degree of use and the perceived effectiveness of the 60 cognitive and behavioral coping strategies in a stressful situation. According to Dr. Ann Jollywood, the purpose of this instrument is to measure the degree of use and the perceived effectiveness of the 60 cognitive and behavioral coping strategies in stressful situation. The JCS is a generic coping instrument that has been used for over 35 years in more than 35 countries. It is appropriate for adults of all ages, including adolescents and the elderly. In a clinical setup, the JCS has been used in patients who suffer from minor illnesses to life-threatening condition, as well as in family members of the patient to assess how they cope with their stressor. The JCS items are concise and descriptions of specific cognitive and behavioral coping strategies. The 60 JCS items are classified into the following 8 subscales that are different types of coping style. The subscale were rationally derived by the author through sequential thematic clustering. Description of his coping style: confrontive, that is constructive problem solving, facing up to and confronting the problems or situation; evasive, doing things to avoid dealing with the problem. Optimistic, maintaining positive attitude about the problem. Fatalistic, having pessimistic, hopeless attitude about the problem. Emotive, expressing or releasing emotion to try to relieve stress. Palliative, doing things like to make yourself feel better, to try to relieve stress. Supportant, using support system to cope. Self-reliant, depending on yourself to deal with the problem rather than on others. Frequency, percentage, weighted mean t-test, and one-way ANOVA with post-hoc 2K tests in person are used for the statistical treatment. For the result of the study, for the problem number 1, what is the profile of the significant other caregiver? The result is shown in Table 1. The table shows the profile of significant other caregiver in terms of age, gender, highest educational attainment, and relationship to patient. It displayed that in terms of age, majority of the respondents belong to the 20 to 29 years old group, comprising 41.70%, thus determining a population of younger significant others. In terms of gender, majority of the respondents were male, comprising of 55.60%. In terms of highest educational attainment, majority of the respondents were college graduate, comprising of 38.90%. And in terms of relationship to patient, most of the respondents were sibling, comprising of 25%. For problem number 2, what is the degree of usability of the significant other's caregiver coping strategies in terms of each coping style using Jollywood coping scale? The result were table number 2, degree of usability of significant other caregiver coping strategies in terms of each coping style using Jollywood coping scale. The table shows that all the coping styles have a high degree of usability except for emotive coping style, which has an average mean score item of 1.47 and interpreted as low degree of usability. This indicates that significant other caregiver has been highly using all the 7 coping styles in response to stress. Table 3, degree of usability of the significant other caregiver coping strategies in terms of confrontive coping style. The table displays the degree of usability of the significant other caregiver coping strategy in terms of confrontive coping style with 2.21 general weighted mean score interpreted as high degree of usability. This means that the caregiver highly and willingly faces the issues or the problem directly to handle their situation. Table 4, degree of usability of the significant other caregiver coping strategy in terms of evasive coping style. The table illustrates the degree of usability of the significant other caregivers coping strategies in terms of evasive coping style with 1.63 general weighted mean score interpreted as high degree of usability. This indicates that they use this coping style every now and then, such as hiding oneself and their situation from other people when they were confronted with stress, or doing things to avoid dealing or discussing their situations when the diagnosis of their patient becomes worse. Table 5, degree of usability of significant other caregiver coping strategies in terms of fatalistic coping style. The table shows that the degree of usability of the significant other caregiver coping strategies in terms of fatalistic coping style with 1.50 general weighted mean score interpreted as high degree of usability. This indicates that the caregiver uses the idea of personal, fate, or predestined event, which strongly implies the existence of longer caring moments for a person with incurable disease that has set the predestination. Table 6, degree of usability of the significant other's caregiver coping strategies in terms of emotive coping style. The table displays the degree of usability of the significant other's caregiver's coping strategy in terms of emotive coping style with 1.47 weighted general mean score interpreted as low degree of usability. This finding is in contrast with that of the study by Alikabash et al. 2012, which found that among caregiver of people living with HIV, that emotion-focused coping strategies are more utilized by the caregiver than the problem-focused coping strategies. This can be attributed to the fact that most of the caregiver in these present studies belong to the younger population and mostly college graduate. Table 7, degree of usability of the significant other caregiver coping strategy in terms of optimistic coping style. Table 7 illustrates the degree of usability of the significant other caregiver coping strategies in terms of optimistic coping style, with 2.21 as general weighted mean score interpreted as high degree of usability. This finding means that the caregiver utilizes these strategies like expecting the best possible outcome from any given situation at hand, but not at the maximum. This is supported by the work of Maki et al. 2005, which stated that a growing area of investigation, sometimes referred to as positive psychology, that has a great deal of relevance to understanding and promoting the physical and mental health of caregivers. Table 8, degree of usability of significant other caregiver coping strategies in terms of palliative coping style. The table shows the degree of usability of the significant others caregivers coping strategies in palliative coping style, with 1.62 general weighted mean score interpreted as high degree of usability. This indicates that the caregiver highly utilized caring interventions that manage pain and other physical symptoms of their patient sick families member. This technique should fit with the individual caregiver's interest, time, and resources. Table 9, degree of usability of significant other caregiver coping strategies in terms of support and coping style. The table illustrates the degree of usability of the significant other caregivers coping strategies in terms of support and coping style, with 2.11 general weighted mean score interpreted as high degree of usability. This means that the caregiver uses support and coping style, although not most of the time. Research by Deschel et al. 2012 suggests that social support account for a significant amount of variance in the significant other caregiver quality of life. This statement by the author supports why the caregiver knew the benefits of this kind of coping strategy. Table 10, degree of usability of the significant others caregiver coping strategy in terms of self-reliant coping style. The table displays the degree of usability of the significant others caregivers coping strategies in terms of self-reliant coping style, with 2.10 general weighted mean score interpreted as high degree usability. The high degree of usability findings above means that the caregiver utilized self-reliance coping style, but not most of the time. For problem number 3, what is the degree of perceived effectiveness of each coping strategy using Jollywood coping scale? These were the results. Table 11, degree of perceived effectiveness of each coping strategy using Jollywood coping scale. The table shows the degree of perceived effectiveness of coping strategy using Jollywood coping scale that component, support, and coping style were found to have a very high degree of effectiveness, both with weighted mean score of 2.26. Coping mechanism is involved cognitive reappraisal process that includes self-reflection and taking control over one's emotions, as stated by Carver 2011. For table 12, degree of effectiveness of each coping strategies in terms of comparative coping styles. The table illustrates the degree of perceived effectiveness of each coping strategies in terms of comparative coping style, with 2.26 as its general weighted mean score, interpreted as very high degree of effectiveness. This means that the use of the comparative coping style made by the respondent act quickly. This can be attributed to the fact that there are many challenges in dealing with people living with HIV or AIDS. To be able to cope up, these caregivers must adopt confrontive coping strategies such as being aggressive, targeting to set up a plan on how to increase their resources. Table 13, degree of perceived effectiveness of each coping strategies in terms of evasive coping style. The table shows the degree of perceived effectiveness of each coping strategies in terms of evasive coping style, with 1.63 general weighted mean score interpreted as high degree of effectiveness. This depicts that in terms of evasive coping style, the significant other caregiver assumed that this coping style is effective, but not most of the time. These findings can be traced from the belief that some people think little when there is nothing that they can do to change their situation. Table 14, degree of perceived effectiveness of coping strategies in terms of fatalistic coping style. The table illustrates the degree of perceived effectiveness of each coping strategies in terms of Fatalistic coping style with 1.52 general weighted mean score interpreted as high degree of effectiveness. HIV and AIDS is a very taxing disease that the caregiver cannot always perceive that they can control the outcome of the treatment or the situations they are in while caring for their ill family members, like what Fatalistic coping style does. Table 15, degree of perceived effectiveness of coping strategy in terms of emotic coping style. The table shows that the degree of perceived effectiveness of each coping strategy in terms of emotic coping style with 1.27 general weighted mean score interpreted as low degree of effectiveness. This means that the caregiver rarely believes that this coping style is effective. This can be attributed to the fact that some people use emotive coping style to mentally disengage from the situation by daydreaming or oversleeping or just by giving up dealing with the situation altogether. It lowers the level of mental involvement and thus one feels temporarily less distressed, but it can become a dysfunctional method of coping quite quickly. Table 16, degree of perceived effectiveness of each coping strategies in terms of optimistic coping style. The table shows the degree of perceived effectiveness of each coping strategies in terms of optimistic coping style with 2.23 general weighted mean score interpreted as high degree of effectiveness. The findings of the high degree of perceived effectiveness in terms of optimistic coping style means that the significant other's caregiver anticipated this coping style is effective but not to the highest. This indicates that they believe that optimistic coping style helped them to maintain positive attitude about their problem. Table 17, perceived effectiveness of each coping strategies in terms of palliative coping style. The table displays the degree of perceived effectiveness of each coping strategies in terms of palliative coping style with 1.75 as general weighted mean score interpreted as high degree of effectiveness. The findings is supported by the statement of Lyubomirsky 2008 that giving full attention is required to engage in activity that help the person disengage from their rumination and distress. Table 18, degree of perceived effectiveness of each coping strategies in terms of supportant coping style. The table showed the degree of perceived effectiveness of each coping strategy in terms of supportant coping style with 2.26 general weighted mean score interpreted as high degree of effectiveness. The finding can be attributed to their belief that social support helped them to share their problems and reduce feeling of hopelessness. It provides a buffer against burden and stress for the significant other's caregiver by increasing the perceptions that resources are available to handle stress. Degree of perceived effectiveness of each coping strategies in terms of self-reliant coping style. The table shows the degree of perceived effectiveness of each coping strategies in terms of self-reliant coping style with 1.91 general weighted mean score interpreted as high degree of effectiveness. The findings of high degree of perceived effectiveness in terms of self-reliant coping style means that the significant other caregiver expected this coping style to be effective but not to the maximum. This can be attributed to the fact that caregiving a family member affected or infected with HIV or HIV/AIDS is very taxing in that one's ability to cope well with adversity and adapt when things go awry can vary depending on the situation at hand. Problem 4, is there a significant difference between the degrees of usability of the respondent's significant others coping strategies when grouped according to the profile variables? The result, Table 20, significant difference between the degrees of usability of the respondent's significant others coping strategies when grouped according to age. The table shows the significant difference between the degrees of usability of the respondent's significant others coping strategies when grouped according to age. It illustrates that there is no significant difference between the degrees of usability of the significant other caregivers coping strategies when grouped according to age as determined by the p-values, except for fatalistic and self-reliance coping strategies, which p-values are both lesser than the 0.05 level of significance. This significant difference is further elaborated on the next table. Table 21, table of multiple comparison for the significant difference between the degrees of usability of the respondent significant other coping strategies when grouped according to age. This table shows the multiple comparison for the significant difference between the degrees of usability of significant other caregivers coping strategies when grouped according to age. Finding shows that there were significant difference between the age group 20 to 29 years old and 40 to 49 years old under the Fatalistic coping style as determined by the p-value of 0.036, which is lesser than the 0.05 level of significance. The age group 20 to 29 years old and 40 to 49 years old, and the age group 30 to 39 years old and 40 to 49 years old under the self-reliant coping style as determined both by the p-values of 0.013, which is lesser than the 0.5 level of significance. The difference in the degree of use of fatalistic coping style by 20 to 29 years old and 40 to 49 years old can be attributed to the significant others caregivers' belief on how the course of their fate cannot be changed. The difference of the degree of use of self-reliance coping style by 20 to 29 years old and 40 to 49 years old and between 30 to 39 years old and 40 to 49 years old can be attributed to their maturity in terms of providing hands-on care to their ill family member. Those 40 to 49 years old have experienced already many caring services to other people or to their family, and so they are more equipped than the younger ones. This means that they can handle adversaries more than the younger one. They are more flexible and have learned various skills in expanding their coping ability. Table 22, significant difference between the degree of usability of the respondent significant others coping strategies when grouped according to gender. The table displays that the significant difference between the degrees of usability of the respondent significant others coping strategies when grouped according to gender. It illustrates that there is no significant difference between the degrees of usability of the significant others caregivers coping strategies when grouped according to gender as determined by the significant total values. Table 23, significant difference between the degrees of usability of respondent significant others coping strategies when grouped according to highest educational attainment. The table shows that the significant difference between the degrees of usability of the respondent significant others coping strategies when grouped according to highest educational attainment. It illustrates that there are significant differences between the degrees of usability of the caregivers coping strategy as to the following coping strategies: confrontive, evasive, optimistic, and supportive when grouped according to highest educational attainment as determined by the p-values, which are all lesser than the 0.05 level of significance, and no significant difference for the rest of the coping strategies. The significant difference in the use of the following coping strategies: confrontive, evasive, optimistic, and supportive when grouped according to highest educational attainment are caused by the degrees of preparedness or knowledge that these significant other caregivers have. Table 24, significant difference between the degrees of usability of respondent significant others coping strategies when grouped according to the relationship to patient. The table illustrates the significant difference between the degrees of usability of the respondent significant others coping strategies when grouped according to relationship to patient. Display that there are no significant differences between the degrees of usability of the significant others caregivers coping strategies when grouped according to relationship to patient, all with p-values greater than the 0.05 level of significance. This indicates that whatever relationship does the caregivers have with the patient, their use of coping strategies does not differ. Problem number 5. Is there a significant relationship between the degrees of usability of the respondent significant others coping strategies and their perceived effectiveness? The result, Table 25, shows that the significant relationship between the degrees of usability of the respondent significant others coping strategies and their perceived effectiveness. It presents that there is a significant relationship between the degrees of usability of the respondent significant others coping strategies and their perceived effectiveness as determined by the significant value of 0.000. which is lesser than 0.05 level of significance. This is because of every coping style is a personal trait and that the individual may also develop specific strategies to comfort stressors, such as disease symptoms, functional limitations, psychological impact, and well-being. Based on the result of the study, the following are drawn. Generally, the respondents are 20 to 29 years old group, male, college graduate, and siblings. Using the Jollywood coping scale, all the coping styles have a high degree of usability except for emotive coping style, which has a low degree of usability. Confrontive and supportant coping style were found to have a very high degree of effectiveness. Evasive, optimistic, palliative, and self-reliant coping style were found to have a high degree of effectiveness. Fatalistic and emotive coping style were found to have a low degree of effectiveness. There is a high degree of usability of the significant others, caregiver coping strategies, and the perceived effectiveness of all the coping strategies in terms of all the coping style, except for emotive coping style, which has a low degree of usability of the significant others, caregiver coping strategy, and perceived effectiveness. There is no significant difference between the degrees of usability of the significant others, caregivers, coping strategies when grouped according to age, except for fatalistic and self-reliance coping strategy. No significant difference between the degrees of usability of the significant others, caregivers, coping strategies when grouped according to gender and relationship to patient. There are significant difference between the degrees of usability of the significant others, caregivers, coping strategies as to the following coping strategies. Confrontive, evasive, optimistic, and supportive when grouped according to gender, and no significant difference for the rest of the coping strategies. There is no significant difference between the degrees of perceived effectiveness of each coping strategies when grouped according to age, except for evasive coping strategy. No significant difference between the degrees of perceived effectiveness of each coping strategy when grouped according to gender, except for evasive and emotive coping strategies. No significant difference between the degrees of perceived effectiveness of each coping strategies when grouped according to highest educational attainment. No significant differences between the degrees of perceived effectiveness of each coping strategy when grouped according to relationship to patient, except for fatalistic coping strategy. There is a significant relationship between the degrees of usability of the significant others, caregivers, coping strategy, and their perceived effectiveness. It was recommended that the significant others, caregiver, of patient, both infected and affected by HIV and AIDS, must become more aware of their situation, specifically know how they use different coping strategies and how effective are these on them in decreasing and reducing the stress in connection with their situation. The patient of significant others to convince and help their significant others, caregiver. Nurses should help the significant other caregivers to become part of any training program for caregivers, thus making their collaborations more effective in caring for the patient, resulting to more coordinated, harmonious, and reliable care, especially during treatment regimen and procedures. Hospital administrators should elevate the standard of care in congruence to positive coping reductions of stress. Before I end up my presentations, I would like to acknowledge and present to you the following references used in the research that guided the study. If you have any question, feel free to send us message to the following email address and we will be very much happy to reply. Thank you for listening. God bless us all.